Hey everyone, my name is Sarah Alsis, and I thought about doing a purse string suture since I do those with placing umbilical lines in umbilical catheters. I'm going to apologize in advance because I don't have someone to kind of help me with the camera, so I'm going to try and angle this at hopefully at some points so you can kind of see what the purse string suture looks like. I'm still kind of working on it. Not the best at it, but still trying. So we were educated by the practitioners and physicians that they would like the initial suture after we place umbilical catheters to be a purse string suture. And the girls in the class will kind of get this. The purse string suture essentially kind of gathers everything and pulls it tight, kind of those kind of drawstring bags that we used to have and carry around. So it kind of cinches all of the umbilical cord around the catheter so it kind of stays and stabilizes it, and then you can kind of further reinforce those sutures. Obviously, this is a sterile technique, but not, obviously, I'm not going to be doing a sterile technique, but this is kind of what it looks like after you've placed your catheter and verified that it's in the right placement in the IVC. If you only are placing a venous catheter, it makes the purse string a little bit easier versus if you need to place an arterial catheter along with the venous catheter, because then you have to kind of do essentially a purse string around half of it and kind of cut and kind of go through the middle of the cord and kind of cinch it around each individual catheter, because sometimes we will take one catheter out and leave the other catheter in. So essentially with the purse string, like the book said, you want to go in at a 90-degree angle, but you're going to kind of do it in, I guess, somewhat choppy motions because you want to be careful and avoid actually perforating the vessel walls. So I obviously, since I'm still learning, kind of go a little slow. So kind of take the forceps and kind of grab the edge of the cord. And you want to make sure you're always, if possible, suturing the cord and not the actual skin on the cord. So you kind of make an initial out to in on the first one and bring it out to in, kind of leaving a tail to initially tie your first purse string suture. And then you have to kind of flip the needle around because this time you need to go in to out. So kind of grabbing some of that and make sure you're kind of avoiding all of your vessel walls because you don't want to, again, perforate that, because it's kind of like if you would just infiltrate a peripheral IV if you were to do it that way. So kind of bringing it through. And then so we're in, we're going to need to go out, or in to out, so back to out. So it's sometimes easy, sometimes hard, depending on how much of the cord you actually still have left to kind of grasp. So we're going to go out to in, or sorry, in to out. Making sure to leave kind of that cord so you can tie, and true umbilical catheters really don't bleed like this. But my cord isn't attached to anything, so it's kind of leaking under my pseudo baby underneath here. So we need to go, and then a lot of times I'll move my catheter so I can kind of get better placement of where I need to be. Because sometimes it's a little hard kind of going everywhere you need to go. So I'm making sure to kind of avoid the artery here, and hopefully when I'm done I can kind of tilt it towards the camera so you can hopefully kind of see where my sutures actually all are. And again, the bleeding doesn't make it ideal to kind of see where you need to go. Need to go back out. And then ideally we'll probably do one more. Usually we like about three to four they like us to have around to really kind of cinch it tight. So one more. In, and then one more back out close to where you started with your initial stitch. That way your knot is close and it doesn't have to kind of go all over the place. So one more, back out. And again, my pseudo cord is bleeding like crazy, so this is making it a little bit more difficult. I don't know if I can hopefully tilt this, but so you want to kind of stay into out, making those little motions. And then all you do is take your cord or take your suture and then do just one tie, grass your tail, pull through, and then cinch. And then you want to reinforce that initial suture, kind of, I call it the over-under, so basically the reverse method. So I went like this the first time, so I'm going to go like this, grab my tie. Sometimes it gets caught in the clamp there. And pull through and reinforce, and then so this way we're going to reverse it, tighten. Sometimes it's hard trying to grasp that tail and pull it through. Tighten. Go. Tighten, pull through, and then one more in reverse. And sometimes you just kind of have to help that tail along. Make sure you don't get that tail caught and cinched. So ideally you want that tight enough to where it's going to cinch it, and then when you start to reinforce it by going up the catheter, you don't want your suture ties to be so tight that you're actually bending the catheter, because then you could create an occlusion. So I don't know if I can try and kind of tilt this, but it's sutured somewhat to the actual cord, but the actual so the catheter won't just slide out. But then we have to do additional sutures up the actual catheter, because this actually keeps it secure. So ideally, as one of the physicians told us, you want to be able to almost lift the baby up by the catheter. That means that you've really got it sutured in very well. So we were told to go up 3 times, kind of like in the same method. You want to just make that initial suture, knot, make sure it's all there, tight, but not to where you're making a kink in it, because that means your knot's too tight and it's constricting the catheter vessel. And then so we're going to go opposite way, 3 times. And sometimes if the baby's moving or whatnot, those lines can kind of creep up on your catheter. So you want to make sure they're as close to your insertion site as possible so your nurses can read where the actual catheter is inserted. And this, you don't have to kind of reinforce those knots because you've done those lines up through. So just kind of push that little wayward down there, suture tight, go around the other way a few times, one more time for 3, put a suture in that knot. And again, before, sometimes if it creeps up I'll push it down before I really pull that suture knot tight. And then one more time around this way. There we go. And then we'll secure that. And pull it tight. And ideally, it's kind of hard because I have my umbilical cord kind of tethered to my pseudo baby, my tissue box. So he won't really pull up very much, but ideally you want to be able to kind of really pull up on that cord without displacing those sutures that you just put, which means that you've actually sutured it to the actual cord, because if you just tied those strings around and pulled up, if you weren't sutured to the actual cord, then it would pull up with you and you'd see more cord underneath that row of sutures. So that's how we kind of do the umbilical catheter placements. First that initial purse string, and then just some simple square knots after we've secured it up the catheter. So hopefully that was helpful, and I will submit this soon.